Hello everyone, welcome to your lecture on sensory alterations. These are the objectives that we will be covering in this lecture. This is just a basic anatomy review of what normal hearing and vision, is. Now for normal sensation to happen, the first thing that happens is the reception, right? The stimulation of a nerve cell called a receptor. It gets stimulated by either of your senses, your eyes, ears, nose, through touch, your five senses. And then the second stage of that is perception. That's when the patient becomes consciously aware of the stimulus. And once the person is consciously aware of the stimulus, then they get signals, to the different parts of the body to have a reaction. So basically, the brain filters the stimuli, and a person usually reacts to stimuli that are most meaningful or significant at that time. The brain becomes a pro at filtering information, right? Because it cannot store everything that you see or everything that you hear. For example, if you're reading a book and say the TV is on, and as you're reading the book, you're really engrossed in the book, you're just, paying so much attention to it, your brain doesn't, hear the TV in the background or hear what people are saying on the TV because it's filtering that information and focusing on what's most meaningful to you at that time. Okay, so the alterations that can happen with your sensory system are, basically sensory deficit, sensory deprivation, or sensory overload. These are the three things that are possible. So deficit is basically deficit in the normal function of sensory reception and perception. Remember we said the first thing is, reception. You receive a stimulus through your senses. Then next thing is perception. So deficit is when there's a deficit in that normal function of reception and perception. Right? For example, examples and signs and symptoms are like visual, like you have cataracts, glaucoma, For hearing, you have, progressive hearing loss. With balance, you have dizziness. Sometimes, with the taste, you have xerostomia, where your mouth is dry, there's no saliva. Right? Neurologically, you have peripheral neuropathy, or people have a stroke. That's sensory deficits. Sensory deprivation are reduced sensory input or elimination of patterns or meaning from the input. So you're getting the input, but you are not, making making it meaningful, right? It's not meaningful. For example, you have, restrictive environments that produce monotony and boredom. This is where sensory deprivation can happen. The examples would be cognitive, for example, confusion, reduced cognition, poor task performance, affective or boredom, restlessness. You have, that increased need for stimulation, right? Because you're deprived. For example, if you isolate somebody inside a room with, just plain walls and nothing there to stimulate them, that's called sensory deprivation. You're deprived of sensory stimulation. Right? Perceptual wise, it's visual or motor coordination changes, reduced color perception, less tactile accuracy. For example, you touch something and your touch sense has been affected, right? Changes in the perception of size, shape, and spatial time and judgment. And we see this a lot in the older adult population. The third one is sensory overload. That's when a patient, person receives multiple sensory stimuli and cannot perceptually disregard or selectively ignore some stimuli. For example, too many things are happening, right? And then there's so many different stimuli that, your brain is trying to filter and trying to make sense of, right? So it varies with the level of fatigue, attitude, emotional, and physical well-being. Now, examples of these are like racing thoughts, like scattered attention, anxiety, restlessness, right? Examples, for example, patients in the ICU or patients in pain. For example, patients in the ICU, they have all these different, alarms going off or lights turning on and off, people walking by, just so much happening, right? That's a sensory overload. Nursing intervention would be simple thing like giving a back rub, helping them relax. Even patients in the ICU, even though they don't seem conscious, they're sedated, right? But every little thing can help them, and they sense these things, right? You're offering comfort, reduce the environmental stimuli for the patient, and constantly reorienting them. These all help with patients who have sensory overload. What are factors that influence your sensory function? Age is a big one, right? Because now they have, difficulty with balance, spatial orientation, coordination, risk of falls, declining sensitivity to pain, pressure, neuropathies. Meaningful stimuli. Patients need meaningful stimuli when they're in healthcare settings. They have a lot of different stimuli, but how much of it is meaningful that they are used to when they're at home? They have certain routines, there are certain schedules, certain things that they enjoy doing. They don't have that in the hospital, right? If you have a elderly patient who loved gardening, they don't have that in the hospital. So that stimuli is not meaningful for them, right? So excessive stimuli, as we know, can cause sensory overload. Lack of social interaction can lead to isolation, loneliness, anxiety, depression. So that's your sensory deprivation, right? We were having a lot of that during COVID when patients had to be isolated. They couldn't socialize. They couldn't, interact with each other in facilities. And that was leading to a lot of, depression in patients. What are occupations that involve, occupations involving, for example, loud noises? If patients who work in big factories with loud noises, it can affect their senses. Chemicals, eye injuries from chemicals, repetitive wrist or finger movement. People who work on the computer a lot or work in banks as tellers, they can develop carpal tunnel syndrome, that's overuse, right? Hospitalized patients are at risk for alterations related to environmental stimuli and change in sensory output. And then as we mentioned, patients on isolation are at risk for sensory deprivation. What are the cultural factors? There are certain cultures that are at higher risk for disparities in care. Okay, so as a nurse, what can we do? What are the cues that we can recognize to help these patients? Get their history, sensory alteration history. Okay, if you haven't been able to see properly, when did it start? When did your hearing issue start? When did you, start, feeling this way? Find out for any mental status changes, like signs of sensory overload or deprivation. If they've been on isolation for a long time in the past few weeks, or, there's an overload, you need to find all of that information out. Then you can do your physical assessment of your vision, hearing, touch, smell, and taste. You can ask the patient to identify different colors, observe how they perform ADLs, notice their coordination, right? How are they able to squint? Any impaired night vision, ask them, when you drive at night, do you have difficulty when, the lights are flashing at you? Have they had any falls? Because lack of coordination can cause falls, right? With hearing, assess their acuity for tinnitus, like that ringing sensation, sound. Conversation, see how they're conversing, inspect the air, look inside the air to see if there's any issues there. Are they just, do they just have blank looks? How is their attention span? How do they react to noise? Or volume of speech? Are they screaming when they talk? Or if you notice a patient is just smiling and nodding when someone speaks, then maybe they have hearing issues. They're not able to hear. Then you have ringing in ears, for example, like tinnitus, and the way they communicate is also very important. And touch, ability to discriminate between sharp and dull stimuli, right? And we do that, right? We poke them with a little sharp thing and say, okay, did you feel this? Tell me if it's sharp or if it's dull, right? It can detect neuropathies, right? Any unusual sensations? Do they feel any tingling, paresthesias, any unusual sensations? Burning, risk of carpal tunnel syndrome, for example, numbness, tingling, and weakness and pain in the hands. Ask them if they have those things. With smell, you can ask them to close their eyes and identify different odors. With taste, they can, you can distinguish different tastes. And then with ability, how they are performing their ADLs, are they safe? Did they have any falls? Things like that. Talk to them about environmental barriers at home. Communication methods, see if they have aphasia. There are 3 different types of aphasia, right? Expressive, receptive, and global. See if they have any of those types of aphasia. Social support, do they have any social support, any family that helps them, any neighbors? Do they use assistive devices? Are they taking any medications that are autotoxic? And what are the interventions that we can do as nurses? We're going to educate, regularly encourage them to get regular screening. We want to prevent computer or digital eye strain. And this is a big one because, everybody's on their phones or their tablets, and even the elderly, they're always indulged in just their tablets and stuff. So we want to make sure that we prevent computer or digital eye strain. How can we do that? By making sure they get regular checkups, right? If they need any special lenses or any vision therapy, you want to place a screen, encourage them to place that screen 15 to 20 degrees below their eye level, about 4 to 5 inches. Place reference materials above the keyboard, not below the keyboard. Minimize the glare. Maybe they can use blue, the blue lenses or anything that can help minimize the glare from their computers and tablets and phones. Tell them to encourage them to rest their eyes when using the computer for long periods of time, like every 15 minutes or every 2 hours. Just look into the distance for 20 seconds and then refocus the eyes. So as they're reading or as they're watching, just tell them looking at a distance 20 seconds and help their eyes to get refocused, and then look back at the screen. Right? We want to teach them the proper use of hearing aids. Make sure they're not damaged. Make sure that there's a battery in there. Show them how to replace a battery. It's extremely important because if they don't know how to do it and it runs out, they're going to have a tough time. Check the volume on it, right? Make sure the ear canal is, clean daily. Remind them of that, right? No hairspray or hearing aid, on the hearing aids. So tell them, like, when they're putting on hairspray on their hair, just take the hearing aids out, put the hairspray on and then put the hearing aids back in. Issues to report, we want to let them know if they hear static, a distortion of sound, or poor volume quality, to notify the provider. So maybe they need a different set of hearing aids. We want to promote meaningful stimuli, things that they enjoy, to keep them, occupied and prevent sensory deprivation. We're going to establish safe environments for them, especially if they have balance and coordination issues. Adaptations for visual loss include, for example, patients with visual loss. We want to create, adaptations would include safe driving education, assistance with the ADLs, safety with the home environment. If they have hearing deficits, then we want to see if they have adaptable doorbells, burglar alarms, smoke detectors, specialized telephones for people with hearing difficulties. And then we also want to talk to them about communication techniques. That's very, very important as well. So when we talk about communications, remember we said they're aphasia, they're different aphasias, right? When your patient has aphasias, how do we want to communicate with patients who have difficulty, right? So we want to listen to the patient. Don't rush them. Don't shout or speak loudly. It's not a hearing problem for them. Use simple, short questions and facial gestures. Speak of things familiar and of interest to that patient. Ask them questions that require simple yes or no answers or blinking of the eyes. Teach them, like in the ICU patients, sometimes we tell them, like, okay, if it's a yes, blink your eye once. If it's a no, blink your eyes twice. There are ways of communicating with people with aphasias, right? Offer pictures and communication boards. So if the patient can actually, the patient can, point at it, like point to the pictures if they can't speak it out. And then speak slowly, give them time to understand and respond. Be calm and patient. Don't pressure and tire the patient. Avoid patronizing and using childish phrases with patients, right? That's disrespectful. For patients with artificial airways, we can use pictures, objects, word cards, so the patient can point. You can offer a pad and pencil, a magic slate, so they can write things down. You don't have to shout or speak loudly because it's not a hearing problem, right? It's just difficulty being able to talk back because they have an artificial airway. Give the patient time to write their messages. Don't rush them. Provide an artificial voice box, like a vibrator, for a patient with laryngectomy to use to speak. Hearing impairments. Patients that have hearing impairments, how do we communicate with them? Get the patient's attention, right? Don't startle them when entering the room. Like, don't just go in and stay quiet and then all of a sudden scare the hell out of them, right? We don't want to do that. Do not approach them from behind. Make sure the patient knows that you want to speak, that you're about to speak, right? You knock on the door, introduce yourself, say, hey, I wanted to talk to you about something. And then, so that way they're aware. Don't just start speaking from the back. Face the patient and stand or sit in this at the same on the same level. Your face and lips make sure that the light is on your face and lips so they can read, your lips. Keep the environment quiet. Keep eyeglasses clean. Keep hearing aids in place and working. Speak slowly and articulate clearly, and use a normal tone of voice. No need to scream. Rephrase when the patient does not understand. Rephrase. Use visible expressions like speak with hands, face, and eyes. Like be very expressive. Talk towards the patient better. Towards the patient's better. Toward the patient. Better ear, right? If they have hearing problems, one ear is worse than the next, speak in the one which is better. Right, then use written information if you need to, if that helps them. Don't restrict the hands of the patient who is deaf. Avoid eating, chewing, or smoking while you're speaking, even like using a computer while you're speaking to the patient. Look at the patient at their eye level, right? Sit down and talk to them at the eye level. Avoid speaking from another room or while walking away. We as nurses, we get so busy sometimes and very task-oriented, and we tend to do that, right? We just kind of, speak to them as we're walking out or as we're walking in. That's not a good way to communicate. Now, when patients are in an acute care environment, and they have sensory deficits, we want to orient them to the environment when they get admitted. This is very important for you to remember. We want to make sure that we have adaptable communication, just like we mentioned earlier. If they have artificial airway, make sure they have communication boards, maybe the magic slate or something, right? Control the sensory stimuli. If they have, sensory overload, then we want to reduce the stimuli in the room, let them rest. We want to make sure that they have safe ambulation. Now, if you notice this picture, this is a safe way to ambulate the patient, especially if they have, any sensory issues, for example, sight or hearing, right? Tap the back of your hand against the patient's hand. Then the person can grasp your arm directly above the elbow. If you notice, the patient is holding the nurse's elbow. Walk one step ahead of the person on stairs or streets. Pause and stand alongside the person, right? Don't rush, don't speed. All right, be sure that the person has a strong grasp on your arm. Relax and walk at a comfortable pace. While walking with the patient, make sure you describe the surroundings to them. If there are any obstacles on the street or, any narrowed passages, tell them, okay, we're going to turn to the right now because this area is very narrow, so we're going to walk around it. Describe the environment to them if they can't see. Never leave them with a patient with visual impairment standing alone in an unfamiliar area, right? To guide a person to a seat, place the person's hand on the back of the seat so they know that this is where the chair is, this is the back of the chair. Then the person you're guiding will find the seat by following along your arm. So these are important, techniques to help to prevent the patient from falling. Now, because that we focus on the older adult, there are certain things that we can do to reduce loneliness in patients with sensory impairments. Spend time with them. Sometimes just in silence. Let them talk. When culturally appropriate, you can use physical contact, like holding the hand, embracing the shoulder. It shows caring. Right? Recommend, alterations in living arrangements if, isolation is a factor, right? For example, if they're at home by themselves and they're not able to get around, you might want to recommend, hey, do you want to live in an assisted living? You could have some more friends there, you can be around people, right? Help patients maintain contact with people important to them, right? Family contacts, things like that. Encourage them. During COVID, we made it sometimes we would make it a schedule to call the family members and, because they couldn't visit their family members. So, they would get the phone and we would make a schedule to call their family members and, take the phone to the patient's room so they can hear their voices and communicate with them, right? To provide that meaningful stimulation, right? Provide information about support groups, right? Let's provide assistive services. Arrange for, security escort services if it's needed. Introduce the idea of bringing a companion, such as a pet, into the home when appropriate. Link a person with organizations attuned to the social needs of older adults. And that is it for your overview of sensory. And next will be your other PowerPoints on vision and hearing. I will see you in class.